In the future, I would like to see more staff for busier times, so that more time can be spent with patients and speaking to them on like a more kind of personal level, rather than just get in there and do the job. You know, it would be nice if it was more personal.
I want it to be like a happy family with staff that feel valued and nurtured, and that we can all grow, because I think it's really important that we grow every day as our services do, and you know, that makes for a healthy workforce.
I think Dorset HealthCare is an innovative organisation, and it actively encourages its staff to generate new ideas to improve patient care.
I worry that at the moment there seems to be a lot of thought that people think there's like a east-west divide. I don't think there particularly is, but people feel that way. So I'd like that to change, that everybody feels completely inclusive under one heading.
I want the organisation to maintain and build on its really high standards. I want the organisation to reach out into the community even more and make the link between hospital and community, to be providing more services in people's homes to vulnerable people and people who need care, and to be the one that looks after people at the most vulnerable times and provide the most excellent healthcare possible.
I truly believe that the move to a locality structure was the right move. I feel we now have a board who are really interested in what our staff are doing on the ground. I think in working in localities we can work closely with GPs. We can actually be a provider that is really meeting the needs of our public, and I just want to see Dorset HealthCare continue in that form.
I see Dorset HealthCare as an all-inclusive organisation that's there for the people in the community, and you know, we're living in quite tough times, and so we've got very tough challenges, but I think we're equipped to deal with them.
I think in the future I'd like Dorset HealthCare to continue the good work it's doing and the improvements it's making, supporting staff. The care certificate that's just come in, I think it's really important. Keep up the good work.
I think as it is, it's progressing and it's becoming a lot more succinct and a lot better for the patients. We're starting up a lot more public health work, which we didn't used to do. It was a lot more of the health visiting and the weighing. So we've started up nurture clinics, which is linking in with minor ailments and public health, supporting breastfeeding. So I think it's that wider range of support for families and for the children that we need to be focusing on, which actually is beginning to happen. I think that will take a little bit of time, but we're getting there.
I think the organisation has got some really good values, and I think we've got the organisation has got some amazing staff, and I found it to be very supportive in terms of training, and particularly for my managers. I suppose to see it in the future is to continue that, and to continue that sort of development of staff, supporting of staff, and really being the best services we can be, and most effective and safest, and all of those things for the families and the children that we work with.
I would like a trust that actually make changes when changes is needed, and also when listen to the member of staff and provide help. I would like the trust to expand and enable excellent care within the community, because one day we will be old and will be looked after. So that's what I'm looking forward to, for the trust to do.
I think the interprofessional working model is very good. So working alongside with social services and all the other agencies that are available to us. So really just more cohesiveness, I suppose, and I know that's something the organisation is working very hard to try and achieve, and it's not always an easy thing to do when you've got different disciplines working from different perspectives, if you like, but for all of us to have a kind of understanding of what each other does and work very collectively together in order to improve patient care, really. That I suppose, in a bigger picture, would be what I would like to see.
I think one of the most significant things that Dorset HealthCare is doing at the moment is joining up services, and I think the whole Better Together programme, co-location, integration is absolutely brilliant. And I think for a long time we have struggled a little bit to sort of get across each other's barriers, but I feel now going forward Dorset HealthCare is breaking down those barriers that have been there, and as a team we are co-locating with our social services colleagues. We've got far better links with mental health colleagues, community matrons. We've been doing work with SWAST. And I think for the patient to have a seamless service from the beginning of their input from the acute hospitals right the way through to out the other side is just fantastic.
I've worked in the health service for many years, and I think I can say without fear of contradiction that it is the best trust that I've worked in over that period, because it's always looking to improve, it's always looking to move forward, it encourages innovation, it allows people to grow within the jobs, and at the end of the day we mustn't forget that we are here for one purpose, and that's to look after the patient. So we are a very patient-centric service, and it just works. It's brilliant.
Dorset HealthCare has great vision, and I'd want to see a better connected service. So somehow there's still a disconnection between the management structure and the grassroots or the clinical or the frontline staff, and I would like to see a better sort of connection where people feel embraced by the organisation.
I hope Dorset HealthCare continues to contribute to a multidisciplinary action amongst the teams and focus on holistic care to the patients in the community.
I'd just like to see more of the patient's voice, really. Obviously, we put them at the centre of the care, but I think they could have a lot more influence in how we do things, so a lot more of that, please.
I would like Dorset HealthCare to continue to progress with the integrated support teams working together for the patients, for safe and effective care.
A flagship organisation, yeah, absolutely the cutting edge, providing super, I think, gold standard physical and mental health care services around the country. So within the chronic pain service, we're leading the way for the rest of the country. And people often come over to see how we run the service. We speak at conferences, nationally, internationally. And I want that for all of our services throughout the Trust.
I want the Trust to be a place that all staff know that they can actually make a change, and for people to feel empowered to make that difference, and not to feel that there's a top-down approach to things, but actually an absolute bottom-up drive to make a difference to practice and care for patients.
At Harbour we have the peer specialists come, and it's created a much more recovery-focused ward where we seem more focused on patient recovery, on individualising care, on co-producing care, and having the peer specialists come in, these guys that have got lived experience to talk to our guys, with us there and without us there, I think has really helped our patients see that recovery is possible, and I'd want to see more of it. I'd want to see more peer specialists coming in. I want to see more people that have recovered working alongside professionals to help people on their recovery.
I want it to be a place where everybody's happy to work and come into work and feel that they, at the end of the day, are really pleased with what they've done and can go home to their families and have that kind of quality of life, both home and work.
I want it to continue doing what it's doing now, being innovative in its development, looking to improve, seeking to engage peer specialists in continuing to develop our services.
I'd like Alderney Hospital to serve the local community, as it already does, but perhaps to develop that further in the future.
I love what we do with recovery at the moment. I love that we've got peers in. They play such a beneficial role with the guys, and I know that they're rolling it out currently on other wards as well. So to see more of them, not just coming in for the skills workshops that we do, which are great and they're beneficial, but in other areas as well, just I think just being around a bit more so that the patients have got other people that they can talk to, because they do relate to them and sometimes they like to share more with them than they do with us. So to have more peers around is what I'd like to see.
An organisation that's happy to support ward and team managers, to give their staff permission to make change at a ward level, and to just support the staff to be innovative.
I'd like the organisation to support staff and to develop staff and also help the patients to go back to the community.
I love change, and I think we need to be, well, better every day. We need to be innovative in what we do. The NHS, I've been in the NHS for 25 years and we can't carry on doing what we do. So I think it's about looking at standards and policy, because that's what I'm about, but making it exciting, trying to be innovative in what we do.
I would like Dorset HealthCare to continue its good work in providing the best care, quality service and evidence-based service or practice to patients and all the people that it caters for. And also I'd like Dorset to continue its good work around research and supporting the staff and just being a good employer.
I think to be the best trust there is, and I think we're not far off that.
I'd like the trust to be able to share and acknowledge the success of the staff, invest and empower staff to be able to make change within their team levels.
We are moving better every day, which is our slogan, and the way they've changed quite a lot. Now we have got so many staff, we are recruiting, so they are doing what they can, and we are happy with the support that they are giving us. So I'm really proud to work at Dorset HealthCare. I'm really proud.
I'd like it to continue to be a happy, welcoming environment.
I'd like Dorset HealthCare to be the best trust out there.
What we need is more health visitors and more funding. But I think that's the way it's going. We're getting more health visitors. We're not up to quota yet, but we're getting there. And that just means that we can do much more of the health promotion work that we want to do.
I want Dorset HealthCare to be the best trust in the country.
Staff well-being, I think, is an important thing. This isn't an easy job. It can be very stressful at times, it's very pressured at times. And staff need looking after. They've got an amazing team on this ward, definitely, and on other wards. And I want to see that Dorset HealthCare continue to support them and help them in any way that they can to keep them doing the job that they're doing.
I would like to see us working more in partnership with other organisations.
We're very lucky. We've just had our staffing levels agreed to increase, which is terrific and make quite a difference to us. You know, it is hard work here, but I think there's lots that we're doing. We're recruiting volunteers to try and help us with more activities for the patients.
Come to Alderney Hospital, yeah.
I'd like it to go back to what it used to be. We had some very good years and then it went downhill and now it's picking up again and there's quite a lot of changes. We're able to do a lot more of the public health work that we used to do, so like the nurture clinic, bringing things back like baby massage and other activities to the families, because they make a difference. You know, they do help families, and it's those things that actually stop them going downhill and needing more support. So I'd like to see that.
I'd like to see the organisation support more of the nurses to become managers or to gain lead clinical skills. At a recent appraisal, I was given the opportunity to find a route where I could seek managerial experience, and my manager was willing to fund that through university courses, which is brilliant.
I'd like to see a little bit more integration between the different directorates, so rather than working sort of silos and separately, this directorate does this directorate does that, this directorate does the other. More rounded working and actually a more integrated service where it doesn't matter which directorate you report into, you get the same level of service, care and staff across every single area of the trust.
I think first and foremost I'd like the National Health Service to remain, partly for me and for my grandchildren and my grandchildren's children. I'd like it to be more so services are actually working in line with each other, so we're all doing, you know, working next door to each other and achieving the same outcomes. so we can liaise with different services on a more streamlined, basis. I'd just like it to continue and grow as it is, because I think it does a very good job.
I love the fact that we're constantly changing, and in fact I think change is our default position, because we're innovating, we're looking for new services, we're looking at new ways of handling old problems, and we have a management structure in place now that actually allows us to do that. Working out of localities is very good, because we can get small teams to work together like a family, and that's just the way we need to be, to actually work together in a community spirit, so we can all pull together and offer the best possible service for our patients.
I love my job. Speaking to the patients, sometimes they can say something that's very small, but it means we can change our service dramatically to help them and others.